pain can come from lots of reasons. One of the primary reasons are disc problems. In daily therapy, we teach the patients how to decompress your back, which is a really important part to taking care of it and making sure that it heals in the proper way. So we're going to go over several different ways to decompress at home and why it's important. It's very important. The disc, as you see here, there's vertebrae. The disc is a fibrocartilage joint right between the vertebrae. When you decompress, you're separating the two bones apart, and that allows better blood flow in and out of the disc. Simply, that's basically what it's all for. So when you take pressure off, it allows blood to move in, and when the pressure comes back on, it pushes blood out. So if you have a disc injury and you want it to heal as best as possible, you actually want to improve the circulation. And how you do that is through decompression. So one of the best ways is using your bed. Okay, I'm going to have a subject here. Unless your bed is on the floor, pretty much any bed height can work. All right, so we're going to have, you're going to take a pillow or two, depending on comfort. You're going to put the pillow alongside the bed. The person's going to come up and they're going to drape themselves across the edge of the bed so that the edge of the bed is hitting you right across the pelvis. Okay, she's going to move up a little bit more right there. Good. And so the pillow, your head's relaxed, you're just hanging over the pillow. Her legs are straight and her feet are on the floor. Now, if the bed is too high and your feet are dangling, well then that's probably not going to work for you. Find a bed somewhere in the house that's a little lower. As you can see, legs are straight, her feet are still on the floor, and how she decompresses is simply just relaxing the knees. And as she relaxes the knees, the weight of her legs and her pelvis pulls down, and they're going to feel a very slight pull right in through here. So basically what she's doing is she's pulling the bones apart, getting the pressure off the disc, which allows blood flow to move into the disc. She's going to stay here for about 30 seconds. After about 30 seconds, she's going to straighten the legs back up, and that compression through here comes back. So it compresses, pushes the disc, pushes the blood out. After about a few seconds of the legs straight, she relaxes the knees again, all the way, relax, and the distraction comes back and it's opening again. So basically 30 seconds relaxed, 5 seconds straight, 30 seconds relaxed. She can stay here for as long as she wants. It can be just a few minutes or 10, 15 minutes. What is actually more therapeutic is her doing this frequently through the day. Okay? Because it's not just doing it once for a good hour. It's about getting a good blood supply in and out of this disc several times a day. So the more often, the better. This is one way. Let's say your bed is too high or too low. So what we can use, you can use at home, you can use a padded chair that doesn't have any arms. You can drape yourself perpendicular across that. You can use a padded ottoman or even one of those therapy balls, a big therapy ball. So we're going to demonstrate using a rolling stool. So go ahead and sit up for me. We're going to take a stool. We're going to take that pillow, because this stool isn't particularly soft. We're going to put a pillow, and she's going to drape herself across this. So we want that about at your tummy. Good. So here, she's going to dangle. Same thing, legs are straight. So with the legs straight, there's compression on the back. And then as she relaxes the knees, it pulls. And even though her knees are really close to the floor, they're still not touching. So the weight and the distraction is still happening through the lumbar. Same thing, she leaves it there for 30 seconds. After 30 seconds, she straightens the knees back up and she repeats. So this can be done on just about, you can find something in the house to make this happen for yourself.